Dr. Rob van Wessem. I'm an equine veterinarian for 36 years by now. I'm a diplomate of the American College for Sports Medicine and Rehab, and I'm also board certified in equine medicine by the Dutch Veterinary Medical Association. I'm working at the Equine All Sports Medicine Center in Mason, in Michigan, United States. I'm also a dressage rider up to the FEI levels, trainer, and I've been a judge. So I have quite an extensive experience in equine medicine, and one of my key fields of expertise is back problems. And on this video, I'm going to tell you a little bit more about kissing spines. Kissing spines is quite a big name for a very complicated problem, and I often call it kidding spines, and I'll show you why. We will go first over the anatomy, the symptoms, diagnosis and treatment options, and then the newest science on kissing spines. The name kissing spines is related to contact between the dorsal processes of the thoracic and lumbar vertebrae. It's also quite often called overriding spines. But this is just a very small piece of the puzzle. What we see here is the skeleton of a horse: head, neck, shoulder blade, rib cage and thoracic spine, lumbar spine, sacral region, hind end, front end. Those sticky things here that stick out to the back, to the top of the back, they are called the dorsal processes, and that's when we think about kissing spines the most. But it's good to realize it's much more, and we'll go into detail of all the anatomy here. It's also good to realize that we more or less talk with this part of the back as a bridge. It's a bridge between the front end and the hind end, and the quality of the bridge, how strong it is or how more it will sink in, is really depending on the quality of all those structures in here, and that's why it's so important to go over the anatomy first. Here we're going to look a bit more in detail of the anatomy of the thoracic spine. Those are the ribs, you recognize those. Here is the real vertebrae, the vertebral body, and this is that dorsal process. And you see in the withers are really high, and we go more to the back part of the back, they're smaller and wider or broader. What we also have here is little joints in between the different vertebrae. They're called facet joints, and they facilitate the lateral motion and a little bit of up and down motion. We also have a joint between the rib and the vertebrae, and there's also a little joint between another part of the rib and another vertebrae. And then we have here an opening, and that's an opening where a big nerve comes through and innervates this segment. There's more to the back than just the bony structures. We also have a lot of ligaments. There's one long ligament that goes from the head to the withers region. We call that the nuchal ligament. And then from here is a long ligament, supraspinous ligament, that all goes close to the tail. And then we have a dorsal sacral ligament at the end. We also have a ligament here underneath it. That's the ventral longitudinal ligament. And all those ligaments are elastic, and they help in making some possibility of motion in this region, but they also keep it in shape. And then in between all those dorsal processes, we also have little ligaments called the intervertebral ligaments, and they really, or interspinous ligaments, and they really keep this all in shape and in place. In this picture you can see all the muscles that are also involved. They have a large pack of muscles, a superficial layer close to the surface that keeps everything in shape. We have muscles coming from the neck that are attached to the back. So it's a very important function, like when we talked about the bridge, those muscles have a very important function. When they are having normal tension, they really help to keep this back straight. When they would really go into a spasm, they quite often make the back hollow. But also when the muscles would be weak, they also will make the back hollow. And we also have some muscles in the neck, and the position of the neck is very important. When it's up, it's easier for the back to be a big hollow. When the neck is lower and the head is somewhere here, quite often the neck gets the back gets a little bit more arched like that. So all important parts. Here we go and look at the nerves that are also involved in this area. The big thing here is the spinal cord. There are a couple of connections, tissue, nerve endings that go already away from the spinal cord, and then per vertebrae you see a nerve coming out, what we call the root nerve, and they innervate a whole segment where they come out of that spinal cord. This video shows you a horse in walk, and what you can see here is the little sideways motion in the rib cage when the horse is walking, and you can really see the bridge function in between the front end and the hind end when that comes into view. There we go. So the back is really a bridge. That's more or less what you need to remember. And so when we talk about a non-functional back, we talk about the breaking of the bridge. The bridge is not doing its job properly. And any of those anatomical structures I told you about, the vertebrae, the facet joints, the tendons, the ligaments, the muscle, the nerves, the intervertebral disc, all of those structures can be involved in the failing of that bridge. And kissing spines is not even covering half of it. It's just a symptom when those bony processes make contact. It's not the cause. And we better talk about back pain of unknown origin until we have a diagnosis, and not just call everything we see on an X-ray kissing spine. What kind of symptoms do we see with horses with back pain maybe having kissing spines? Well, we see they compensate for back pain by altering their movement. They can have a hollow frame, traveling with the head high, or have it really low with a hollow back, normally then more normal than normal. We quite often see problems in the canter. They don't want to pick up the correct lead, they cross canter a lot, or they don't really have a good 3-beat canter. We often see a loss of top line, muscle wasting or atrophy on the part of the back or the whole back, and even sometimes the hind end, as a result of not being used properly, or maybe as a result of disease of the muscle itself. We can have stiffness, general lack of flexibility, or resistance to bending one direction. And what we quite often see is that they don't want to jump anymore, certainly, because the going up and arching the back, and especially the landing, making the back hollow, is painful, so they refuse to jump. There are also a lot of behavioral problems that we see with horses with back pain. We quite often see it when we do the activities that put pressure on the back, sometimes like grooming or putting the saddle on. Some horses have girthiness and really are not happy when you tighten the girth. They can be very sensitive to touch. They don't like to be touched or brushed and can really pin their ears or even try to bite you. When that's the case, we quite often talk about some nerve involvement. We'll go back to that later. They can have difficulties to be mounted. They don't want to stand still or run off as soon as you get on. And then we have real explosive behavior with bucking, rearing, bolting, kicking, especially when something at that moment is painful, like landing after a jump or a very specific dressage exercise. What you see with all those symptoms is that they are not very specific. There is no clear indication where the pain comes from based on the symptoms. It's a complex, and the problem is complex. So when a veterinarian walks up to a horse when they have those problems and they touch the back and they say it's painful, and they make an X-ray and they say it's kissing spines, they're missing a bunch of steps, and that's not going to help you to try to find the solution for this problem. The first really important step in fixing the problem is a diagnosis. We have to find out exactly what is going on. It's a very complex problem. So we have so many tissues involved or potentially being involved that we need to evaluate all those structures to get a good idea what's going on. Just looking at the bone is a very small step. All the other pieces need to be evaluated too. And my experience, and experience from a lot of specialists in the field, is that kissing spines is a most misdiagnosed or overdiagnosed problem in horses. It's often not really there, or it's simplified as like, well, it's just a bone, but there are more and more problems going on. What kind of possible diagnosis do we have? And we have even more than this list, but just give you a couple of them. We can have arthritis or synovitis of one or more facet joints, the joints in between the vertebrae. Arthritis is when really the bone and the cartilage is damaged. Synovitis is when it's just the inside layer of the joint. And we can also have capsulitis when the capsule is irritated, but the bone is still intact. We can have damage to the supraspinous ligament, what's called desmitis. We can have damage to the interspinous ligament, also called desmitis. We can have muscle pathology with PPMS or MFM, or maybe a general myositis. When the muscle is not doing its job properly, the bridge is not going to hold. We can have muscle weakness. Several causes for that. Sometimes mineral disbalance, not appropriate diet with not enough amino acids, or like PPID, Cushing's disease. We can also have nerve issues and root nerve compression, what's called radiculopathy, and then nerves don't do their job properly and cannot really guide muscle contraction, or even worse, with sensation or painful sensation is coming from that nerve. Then we have what everybody calls kissing spines, damage to the bone, to the spinous processes, because they reach each other and bounce into each other and they react to that. Very common also we see saddle fit issues, and some horses that are sent to me for kissing spines just have saddle fit issues. What's a different kind of problem. And then some of the problems are riding problems. When people want to get the head too high and the back becomes too hollow, you can imagine you predispose your horse for kissing spine problems. Think about saddle seat or Morgan horses or dressage horses that are lifted up with their head too high compared to their level of training. After a physical exam, next step is diagnostic imaging. We need to see what's going on that we can see on X-ray. Bone problems, we can see how the dorsal spinous processes are, if they make contact or not. Radiography, X-rays is really good for that, and scintigraphy, bone scan, can also work. And ultrasound might be a part. Ligament problems, you only can see them on ultrasound. And facet joint problems, they're really difficult to see on radiographs often. Ultrasound is a great tool, and bone scan is a good tool too. Muscle problems we in general detect with blood work, and sometimes a biopsy, and sometimes electromyography, when we stick a needle in the muscle and see if the signal from the nerve is conducted to the muscle in a proper way. And the same thing is for nerve problems. We need to do a good neurologic exam and maybe again an EMG. So what you see in general, for good diagnosis, you at least need X-rays and ultrasound. So when only X-rays are used to make the diagnosis, we have to realize it's an incomplete diagnosis and it's maybe not the real problem or the complete problem. With radiographs, we take lateral images, meaning from left to right or from right to left. Quite often when sedated, and what we need to realize is when the horse gets sedation, especially when it's a lot, quite often the muscle tension goes down a bit and the back might sink in a bit. So when you make an X-ray at that moment, it can look like the vertebrae, the dorsal processes make contact with each other, but it's just based on sedation and not a real thing. We also need to realize that the image needs to come perfectly from the side. If you come a little bit from the front or the back too much, it can look like the dorsal processes make contact, but that's just because of improper angle of making the image. What a very good trick is make a belly tuck. Scratch the horse under the belly, it will lift his belly, lift his back, and then make or the first image or for sure the second image if your first image has been made and it looks like you have contact with the vertebrae. Quite often you see when you do the belly tuck, there is no contact, they're away from each other. And then we have images under an angle, what we call oblique. Sometimes it's used to look at the facet joints. And we also have to realize that the handheld machines that you can bring to the farm cannot really image the lumbar vertebrae. Sometimes they are even not very good at making images of the thoracic vertebrae. Let's go over some X-rays and show you what we can see here. Those are those dorsal processes, and you can see they're really long, so they're in the withers. And what you can also see is that it looks like fragments. What's good to realize is this is normal in any horse that's not really old yet, and they're quite often called accessory centers of ossification. So it's areas where the bone is not completely calcified yet, and it looks like that. I've seen many veterinarians call this fractures and then condemn the horse for a major problem, and it's completely normal. We also could see all those vertebrae, all those dorsal processes don't make contact. It's perfect normal. In this image, we can see already that two dorsal processes making contact. But what I have to realize is it looks like this one goes here, the other one goes here, so they can not even make completely contact, but be to the side of each other. What quite often happens when they make their back a bit hollow. This is not a sign of having bone changes. This is just a sign of making contact or even be superpositioned on top of each other. Here we can see a little bit more reaction with some extra white bone here and some black here. That's more likely some real bone reaction. But again, it's good to realize in completely normal horses without any complaint, we can see that. This case is a little bit more advanced. You see really funny shape of that dorsal process, so extra bone has been forming here, and then there is bone resorption, all that black here, and you see that here a bit too, and you see that wider line of the bone, what we call sclerosis. This is really bone changes. But again, we see that sometimes in completely normal horses. So when you see an X-ray like this, you cannot conclude this horse has kissing spines. You only can say some vertebrae make contact and there are some bony changes. That's the only conclusion. Another X-ray, you can see here the ribs, part of the spinal column, the vertebrae, and then here those dorsal processes. You can see here where the withers, here we come more in the lower part of the back, close to the lumbar spine, and you can see some reaction here with some black areas, meaning bone resorption, and some extra white. So this is again a proof of some bone reaction, but nothing more than that. Completely normal sometimes in older horses. And here is a surprise. In newer research shows that there is no correlation between the severity of the problems on the X-ray and the severity of the clinical problems. So horses with a perfectly normal back can have, on X-ray, can still have major problems that you cannot see on the X-ray, for instance when it's in the soft tissue or the nerve, and other horses with a lot of changes on the X-ray just don't have a problem with it. It makes their back a little bit more stiff maybe, but they're perfectly happy doing their job and not in pain. We also see that when we look at necropsies for horses that are died from an unrelated reason, we can see that 85% of the horses show some signs of kissing spines. So it's very normal in normal horses. X-rays are just a small part of the puzzle and not the proof. While in most cases I see the only diagnostic thing that really has been done is X-rays, and then the horses are diagnosed with kissing spines, and as you can imagine, that's not correct. When we talk about ultrasonography, you need somebody that really knows how to do that for the back. It's much more difficult than when you look at the tendon at the leg. You also need to realize that you need a high quality machine with a higher penetration and calculating power. It needs to go deeper, so it needs to be a much better machine. That quite often means that the little handheld machines that a vet can bring to the barn are not really capable of imaging the back properly. We also want to make images in at least two directions, like longitudinal from front to back and like from side to side. And another thing that's really helpful for the ultrasound is using power Doppler. It's a way of looking with color to blood flow, what tells you if there's more blood flow in a certain muscle, or some more blood flow close or into a ligament, or more blood flow close or into a joint. What really helps you to tell where active inflammation is present. And power Doppler is only on the higher quality machines. Again, in general, you cannot really do a good ultrasound of the back with one of the machines that you take with you. A very nice example of a horse that had been diagnosed with kissing spines, but it was completely something different. What you see here is a slice through the back of a horse. What you see here is the top of the dorsal process, so the dorsal process goes down. You cannot see that on an ultrasound because it's black. But this is the supraspinous ligament, and it should be just looking like this. And what you see here, there's a split in between, and it's much bigger here on this side than here. And this picture shows you that even more complex. Black, and here a nice edge of the ligament, and here all weird. So this horse had damage to the supraspinous ligament, really painful in the back. Because it's so painful, it will be crooked, because this here is the right side of the horse. This is the midline, so this horse is more crooked to the right because he has a lot of spasm to try to not stretch this. And we can also imagine that the horse has a hollow back, and if you look at the horse and you would make a picture and you see some changes on vertebrae, you say, ah, kissing spines, but your problem is a ligament problem. And this is an ultrasound that looks at the facet joint. It's again a slice through the horse. This is the midline, and what you see here, this is a facet joint in the thoracic spine, and here too, and you can see here is a small joint, here's a little bit more white. And what we really like to use, that could be even completely normal. What we really like to use is power Doppler to look at blood flow. And when you see one joint with a lot of color around it, blood flow, you know that joint is really inflamed and painful, while the others are normal. What kind of treatment options do we all have? As you can imagine, it really depends on which structures are involved. We have at least oral anti-inflammatory, like bute or firoxib, Equiox. We can use oral corticosteroids, dexamethasone, for nerve impingement, very effective, but only for that. We can give osphos, that's an injection, to reduce the bone resorption. So if we have a lot of black areas on our X-ray, then osphos might be helpful. But contrary to normal belief, osphos is not an anti-inflammatory. So it only works when you really have a lot of bone resorption, otherwise it's doing nothing. Chiropractic adjustment, you can imagine, without a diagnosis, you have to really be careful with that. Injections with corticosteroid in tissue or in joints. What we quite often see with that is that those corticosteroids might be really helpful in reducing pain for a while, but they're also really strong in stopping healing of ligaments. So when you have a ligament or tendon problem and you're giving a corticosteroid injection, you just delay or even stop forever the healing of ligaments. You can even make them calcify. Shockwave is a therapy that's quite often used for kissing spines. What it more or less does is it makes the C-end nerve endings dull so they don't feel less. So then it's even more careful in using a horse with that when it has got shockwave, because it might overuse it because it cannot really feel things. It's not really doing anything to the lesion other than making it less painful. Mesotherapy is when we inject the horse with a bunch of very small amounts of injecting just under the skin. It's not really any effect really proven from that. We can use laser, and if it's really a surgical laser, it might help, meaning that a veterinarian needs to use it. A lot of lower quality lasers or lower grade lasers, like blankets with all kind of red lights, they do nothing. Their action is only like less than 1/10 of an inch into the skin. And then we have surgery, where they can cut some ligaments or can even cut the bone away. I'll talk about that in a bit. And then we have all kind of tools like MagnaWave and things like that, and shaker plates that have not any scientifically proven effect. The results from medication only, so do nothing but just give them bute or Equiox, are very low. Even less than 15% has some help with that. Shockwave gives some effect, but it's very long, very short term. In a week or 2 weeks it's gone. Same thing with chiropractic adjustment. Meso and laser also no long-term effect. Might make it be a bit better for a little bit, and then the problem is back again. Quite often because we didn't really fix the problem. We just dealt with pain. Surgery that needs a long process of revalidation and rehab. And we see that if we don't do rehab after surgery, then there's less than 50% of effect. What quite often works the best is a combination of options, of all the treatment options, based on the diagnosis. If it's ligament, it will be different than when it's really bone on bone. When it's a facet joint, it's different than when it's a muscle disease. So you really need to realize that a standard treatment option doesn't exist. Surgery at the moment seems to be a little bit more up and coming because people think it really is doing something. The good thing from it is it can be done standing, so the horse doesn't have to go under anesthesia. They use a scope, so it's less invasive than it would maybe have been in the past. And what they do quite often, they cut a couple of those interspinous ligaments. By doing that, they also cut the nerves that are in there, and then because of doing that, you do a neurectomy, meaning that you take away the feeling of the tissue there, the fascia and the nerve. Problem with that is that the horse cannot really feel properly anymore and doesn't really know where parts of the back are and cannot really protect it. Also, you create a permanent instability. By cutting that or even taking away pieces of the bone, that's another surgery technique where they really take 2 or 3 of the dorsal processes away, you make far more instability in the back, and that would never happen in human surgery at all. All human surgery for backs is focused on stabilization, like rods and screws to make things stiffer, not more flexible. You can imagine we have a bridge that's already failing, it's hanging down too much, and then as a result we're going to make it even weaker. That doesn't make any sense. And now the surgery has been done for a couple of years now. We can look back at results and we see that they're very disappointing. A lot of those horses do decent during rehab, if we do some rehab, and then as soon as they come back to normal work, they show the same problem back again or even worse. So when do we surgery? Well, some veterinarians, especially surgeons, will say as soon as we have symptoms, we should do the surgery as early as possible. What I cannot understand why. And others say it's a last resort treatment. And you may think about that. You have to realize that there is no way to go back to a situation before surgery. If you cut a ligament and you cut some nerves, that's there forever. And if you cut the bone, it's even worse. You cut that forever. So think about doing surgery really before you're deciding to do that. Two recent papers show you, when they look back at cases, so they have a bit more information on how they do over time, and show that the results are not as good as we thought before, and only maximum 50% might come to back of some kind of work. When you look at how many horses really perform the original job, it's very, very low, maybe even lower than 10% after 1 or 2 years. This is another paper, and it also shows that less than 50% comes back to work. What they saw is that if you do surgery, then you have a better chance that the horse is doing a bit better than when you do nothing. Well, that's nice at least. We also see that you have a 10 times higher chance of success when you go through rehab. Rehab before and after surgery, or even rehab without surgery. When we inject the facet joint to be no longer painful, and then there's some more motion in the back. And then we can use rehab to make the back more flexible and strong. That's useful and has a better chance of return to full work. So what's the conclusion? Diagnose, diagnose, diagnose. As long as you don't know what's going on, and you don't know which specific components of the bridge have a problem, you can imagine any treatment is just a guess, and quite often you forget things, or you might not even take care of the main problem, and you will have bad outcome. A physical exam, radiographs, and ultrasounds are a minimum. If you didn't do all those things, and a physical exam takes like half an hour at least. It's really walking, trotting, cantering, maybe riding, do a lot of tests to see the flexibility of the spine, see areas where it's painful, do a neuro exam. All those things have to be done. If that's not done, your diagnosis is not correct. You might just try to fight something that you have no idea what it is. And therapy and rehab are individual per case, based on what's wrong, which tissue is damaged, what do we do, and how old is the horse, what's the use of the horse, all those things. And rehab is mandatory. Without rehab, you don't get anywhere. But the rehab really depends on what's going on. Stretching exercises might be really good for one case. For instance, when we think about ligament damage, quite often stretching is a good exercise, while with muscle damage might just be contraindicated. So you really need to know what's going on before you can make a plan for good rehab. And what you will see is that the specialist gets much better results than the average veterinarian, because it's just a too difficult problem. They don't even know all the components of the bridge, so you cannot expect them to help you properly to go through this problem in a right way. I really want to thank you for learning, for sitting out this whole video and listen to me. I think one of the most important things for you is to be critical, be educated, so you can help your horse in the best way. And I have to say, it's often cheaper to go all the way and finding out what's going on than going a standard route with local non-specialists like chiropractor, Beamer therapy, all those things. I can tell you it's not going to work, because they don't really know which parts of the problem are really the main problem. So any treatment is just a guess.